Good morning. How's everybody this Saturday morning? I just wanted to do a quick video. I am still working on the classes, so just adding more stuff. You know how I do. I hope everybody's doing well. Everybody be safe. Don't go out if you do not have to. If you don't have to, don't go out. If you're an essential worker, just, put your mask on, put your gloves on, and be safe. Think safety at all time. Sometimes we kind of flow off and we lose that state of mind of, oh God, let me protect myself. Let me protect other people. So, stay in that state of mind, because you can go to work and just get lax. Because, working nurses, teachers, doctors, whatever, their work is like second nature. You go to work and you just be lax and not realizing that, okay, I'm at work and I still have to stay focused on what's around me, because sometimes, you can get lax. Because I see some nurses and stuff that's on TV that's like, she doesn't have a glove on, she doesn't have a mask on, and, I'm looking at TV and I see all the nurses coming from Atlanta, different states, South Carolina, all over. And, when they get here, they're like, oh my God. And you should see them. I mean, they want to cry themselves. Who wouldn't? I mean, we're losing a lot of people. To me, this is about, saving lives, saving lives matter, and again, this is just my opinion. People staying home, they have it, they stay home, they living. You go to the hospital, I don't know what's going on, people are dying. And, it's so sad, but we got to just pray and hope this thing just goes over and we do not lose our whole society of people. I don't know. Lord, please help the terrorists. What do you call them? The POTUS. Please help the president. Now, listen, that's just my opinion. But listen, we all can have our opinion, but we've got to pray on this man. We have got to pray on this man. Lord, please come inside this man and make him see light. Make him understand. Give him the power to accept power from other people. Give him the power to accept right from wrong. Give him the power to understand what is really going on. Because I'm going to tell you right now, I'm not trying to pass judgment on my POTUS, but I'm trying to stay away from that. But he need help. Hopefully it's just, we could just keep moving. But right now, there's nothing we could do about it. All we could do about it is pray on it. That's all we could do, is pray on it and hope, he changes his mind. Especially, he like when he will come and say things to him. But, just pray for the man. Okay, so, I wanted to talk about the Medicare issue. Now, they did say yesterday that Medicare was going to pick up a lot of charges. To me, if the physician is not a participating Medicare provider, he may not be able to participate in that. Or, physician may say, no, I'm not participating in that. You never know what's going to go on in the billing. I mean, they're saying it, bro, but I don't hear a lot of the details. So, a lot of patients out there, you guys don't have insurance. Pay attention to the detail. Public sector and non-public sector hospitals. When you go to a public sector hospital, that is a hospital that takes city patients, people who don't work, homeless people, anybody who doesn't have insurance. In public sector hospitals, when you go there, you see a person sitting there with a table. That person that's sitting there with that table has insurance for you. You pick, you sign up for your Medicaid, then you pick a managed care organization. It could be HIP, Blue Cross Blue Shield, United Healthcare, whatever. You know what I'm saying? They have it ready. Okay, so she needs insurance. She doesn't have insurance. The provider is not going to deny you service. They will get reimbursed. That's what the reimbursement is. The provider sees you, takes care of you. They bill. The billers, the credentialing, whoever, they have to work on the claim and get the claim paid. If the patient is missing something, they have to submit it. They have to call the patient. There's a lot of things that go on. I mean, when you have some patient that come from out of state, come to another state, I mean, they have a rule. Yeah, we balance billing the New York patient. Okay, but the CT patient that has Husky, no, we're not balance billing them. But different states have different rules. Now, this is the federal government. They holding statewide. They said that Medicare is going to pay at at a Medicare rate. So we're looking for that to go down, but it's not going to be as sweet as they're saying it on TV. I'm telling you, it's going to be a lot after that. Now, I'm not sure how it will affect the billing department on a paper documented standpoint, but in my personal opinion, we're going to lose a lot of money. We're going to lose a lot of money. And people at some point may get laid off if they don't work. You got to, when you're trying to do billing and coding and drop them codes and get them bills out of there, you have to get that money. You have to get that money. And sometimes you have no walls to turn up against. You cannot get it. But you have to stay on it. The same rules apply. Get the claim out, get the money, XYZ. Same rules apply. You got 90 days to get this. If you don't submit this claim, XYZ, you write it off. You're not getting this. So, it's more to it than them just saying, Medicaid, we're going to pay y'all that Medicaid rate. Okay. So to me, the non-public sector are my boy Cuomo, upstate. You hear when he say upstate and then he say downstate. Downstate, there's Queens General, Jamaica Hospital, NYU. Those type of hospitals take city people, New York City people on the street. You just walk in, okay, we'll bill you. We're gonna see regardless. The providers have it. Oh, they gotta see the patient. That's their job. That's what they're supposed to do. Their oath is to take care of this patient. Do not let this patient die. And now that I'm hearing that they may get paid by Medicare fee schedule, Medicaid rate. Maybe, upstate will let the patients come over there. Because, see, to me, I don't know. You guys let me know. As far as him taking the ventilators and bringing them to the downstate hospitals, because there's so many patients, the upstate hospitals know that the downstate hospitals got a lot of patients that may not be working. Now, the patients that may have, low income, what I'm saying? The upstate hospitals, you're talking about two different type of entities. So that's what he's talking about, and he's like, okay, so you don't want to give me your ventilators, huh? You don't want to let us use any? Okay, well, I'm taking them. Okay. And I don't think he should address it as upstate, downstate. It's all one, because then you make one facility like they're better than another facility. Now, I'm not going to lie. When you work if I'm in Brownsville and I'm working in a hospital in Brownsville versus I'm working in a hospital in Long Island, North Shore, or Long Island, or something like that, you're going to have totally different type of claims. You're going to have totally different type of billing. I'm not going to explain what type of billing is going to be differentiated, but I did read my lips. Brownsville Hospital, Long Island Hospital, upstate, North Shore. You're talking about two different type of things going on. So you're going to bust your behind dropping them bills in Brownsville. You're going to North Shore, you're going to be dropping bills. Did you hear my voice? So obviously what I'm hearing some of Cuomo saying 2 days ago was in that format. Now it's unity. Now it's no, we're all one. Upstate, downstate. And he had a smirk on his face. So all right. Well, I'm signing XYZ for you to give me the ventilators. They're not getting those ventilators back. They're not. I really just don't see them getting those ventilators back. He's going to have to pay them, and that's going to be that. The administrator going to have to work on getting more. To me, take the patients over there. Why the patients can't go over there to be seen? That way they can keep their ventilators. But now, since they know that they may be paid, they might take some of our patients. But then again, they got to risk their upstate, non-public sector with the downstate affected people. So that's why it's better for him to take the ventilators from them and bring them here, so that town is not infected. So, a lot of this, what's going on, y'all know how I do. I'm into the billing, I'm into the coding. And when I drop billing, forget about it. Y'all know I get carried away. But this thing right here is so crazy. I just can't. It's like a nightmare. And I mean, it holds you right in your... I had so many plans that I had to do. Building a house, this, that, this. How many years have I with this? It's like, boom, every time somebody, I'll tell you, something hit, like a bat hit you in the face. But you got to do what you got to do. I did write something down, but y'all know I really don't need to look at that. But I try to keep track and document everything that I write down. And I did put this on Facebook and I did put it on YouTube. But as a billing and a coder, you have to keep up with these things. I want y'all to make sure that y'all are watching this TV, because a lot of things that they say are pertaining to your job. They are pertaining to your job. And one thing I don't want you to do, a lot of these people that are out of state, out the countries and everything, they see your resumes on, they know you want to do billing, they know you work at home or you XYZ. Don't give those people all your information, because those people, they can take 1,000 or 1,000,000 people, oh, such and such and such and such, and somebody else get it, and you don't get, they don't even call you back or nothing. I have a lot of students that went through that. It's like heartbreaking. Don't deal with them. Deal with the company direct if you want to get hired. And again, work on the questions. In the classroom, I did post questions, interview questions that are going to be on there. The Medicare questions, HIPAA questions, ICD-10 questions, CPT questions, and they're just general questions. That's what I call open and closed questions. Now, there's a difference between the billing open and closed questions and the coding open and closed questions. I have both in the classroom. But right now, we're talking about the billing. Okay, we're talking about the bill. Those claims are going to be dropping like hotcakes, and there will be a lot of self-pay patients. Trust me. They're saying that they're mandating patients who have to be self-pay not to be billed. Now that's Medicare, no deductible. Medicare, no 20%. Okay, so what about the rest of them? I heard something about Cigna and something else. And you can mandate a managed care provider. A managed care provider has opted into managed care. And that means that there's a whole community of them that have opted into this. And that means that the federal government can do this to them. You know what I'm saying? That's just like a patient, if you take Medicaid versus a patient who have fee-for-service, commercial insurance. If I give you 1 million Medicaid patients and 100 commercial patients, you're going to get more money from the Medicaid patients. You see what I'm saying? So they've got the providers to opt into that. But there are some providers, no, I'm not, no, I'm going to stay independent. I'm going to stay an independent provider. You know what I'm saying? Those providers, no, you need to pay him what he asked for. You know what I'm saying? And then there's a lot of providers that actually work for the facility. You know what I'm saying? But then you're still going to take a hit because if the provider works for the facility has to pay the provider. Now, I'm not talking about qualified healthcare workers. Remember that. That's on your test. Qualified healthcare workers, you know how to say other qualified healthcare workers, nurse practitioners, physician assistants, those people can't not get paid directly. They are killing themselves just like doctors are. They are doing their thing. And I'm going to tell you right now, those doctors and nurses, they're going to be traumatized from this. I don't care what your oath is. You've seen all them patients in that morgue. I told you, when me and my sister used to take them bodies downstairs, oh my God, that's what threw me away from working on the floor or anything. It just, and the leg, it was so heavy. It was like, here, come on, Lisa, we got to take a body downstairs. And again, that's my sister. I can't let her go down there morgue by herself. I was going to go with her. But this thing is traumatizing to see all those patients. It's like death in the air. I'm telling you, it's like 911 all over again. It's like 911 all over again. I hope my sister don't want to go out. She always want to go out somewhere. But anyway, it's going to be traumatizing. I'm trying to make this short, but I'm always trying to make my videos short, but it don't work. But again, the billing is going to go ballistic. And, shout out to all the doctors and the nurses. Shout out to the nursing assistants. I heard the president, what is he? The assistant president, the vice president. The other day, you guys probably was paying attention, and I was wondering why in the world haven't the CNAs gotten any respect? The CNAs are on the front line. The CNAs are doing the dirt. The CNAs still have to be in the hospital with the nursing assistants. Respect to all the CNAs. Finally, I hear the vice president say, thank you to all the nursing assistants. It's not just all the nurses and, the doctors. It's everybody who works in that medical facility. Respect to all of them. I don't know how they do it. That's why I had to back out of that. But, I would gladly go back and be a nurse. I've said that before, that I was going to go back to school to be a registered nurse. I don't know. I still want to do it because, there's registered nurses, and sometimes you have to be a registered nurse to oversee a lot of the coding too, because that has to relate to the doctors. And sometimes they don't let the coding managers, train the doctors. Because, most of the doctors in the physician setting, they drop their own codes. They general 99212, 99213, 99211. You know what I'm saying? Those type of codes, doctors and physician offices, they dropping them quick. That's why I said, if you guys do, choose to do the code, and then you go to a physician office and work, that's different. If you go to an orthopedic office or a cardiac office, that's the only thing you're going to be coding. Boom. You go to a hospital, you'll be coding everything. You can go to a hospital. It's physician coding there and hospital coding. So remember, that training certificate is HIPAA. You have to do that. CCS is not too bad. The rest of it is, you're going to have to know it inside out. They got a lot of OSHA, all that stuff you got to know for the hospital. Physician too, but you bill for both. So when I say physician coder, it's not that you're going to a physician office all the time. Physician coders are in the hospital as well. We have to drop those codes for them. So, the Medicare situation is like, I can't wait to see how this thing is going to pan out. Well, remember, there is going to be a billing explosion. I suggest everybody take medical billing. Okay, take the medical billing. You got to split between my course. You can take medical billing and coding, or coding and or medical billing alone. Now, it's still free. It's still free because I'm still actually developing the class. Every time I hear something, you know how I am, I snatch it and I'm dropping it in the class because I want to hear what y'all got to say. My students, they know me, yeah, I'm straightforward. You could hear my voice, I'm straightforward. But generally, if my students are telling me something and I'm not clear on what you're saying, you need to keep explaining that to come back to me tomorrow and let's get this together because I have no idea what you're talking about and give me the right answer. You know what I'm saying? Let's go through this X, Y, Z. We go step by step to what we have to do. Because I usually see a lot of my students. Tiffany White, if you hear me, go girl. She is one of my graduates. She's in a billing office and she works for physical therapists. They be asking her everything. And I know all she do is Miss Lambert this, Miss Lambert that. But that's how I want y'all to be. Be like Miss Lambert. Okay? Be like Miss Lambert. Do what you got to do. And I told her, well, don't tell them all the bad stuff that I used to do in the school, but it is what it is, and y'all gotta brace yourself. All of the prior graduates, all of the students, if you need a brush up, go into the classroom. What you can't go, just send me an email. I gotta give you a password to get in the classroom, but everything is in the classroom. Everything that you guys need. Right now, I'm uploading hundreds of ICD-10. You've got to do the ICD-10. I want to see you find those codes over and over and over and over. I flip through that ICD-10 book. That's what I want you to do. That's why I'm giving you so many ICD-10 codes. Get used to that book. It's going to be second nature to you. Watch. You start flipping, find this code, that code, K, L, M. Keep going, these numbers. When you finish all those exercises that you're doing, that book is going to be second nature to you. Trust me. CPT, same thing. I'm going to give you hundreds of CPT. I want you to look for them. Go in the tabular list and check them. Make sure they are right. Trust me, I'm grading your test. Don't forget, when you go on the discussion board, I'm putting the stuff in there. Take it off, post it back to me. Write what you want to write. There's also, I think they still have that little knapsack thing on in the discussion board too. But the Medicare, I get thrown off in a minute. Just, if you guys don't know Medicare, some of you guys got the insurance handbook. Some of you guys go on Thrift. You can get that book for $5 on Thrift. The new one is like $100. I'm not going to go on, but it ain't changed that much. I mean, don't take no codes or nothing out there, because if you get them old books that got ICD-9 in them, that's not no good. And a lot of the rules changed. It's just the basics. Get the insurance handbook just to see some of the basics in there. You probably can get the 2018 for like $20. Look in there. Look in the insurance section. Look in there. PQRS, Physician Quality Reporting. They're going to have to do that. It's so much to billing. It's just as bad as coding, I'm going to tell you. The difference with the billing is coding, you literally have to be inside the doctor's head. You literally have to be in the OR. I'm going to tell you right now. You have to be so medical terminology savvy in coding. That's the first thing that we're going to do. Y'all know how I am about the coding. Medical terminology is the key to the coding. There's no way you're going to get it without that. That's why I throw these things out there, to bring them back to you, to have y'all look them up. Look them up on a computer. You don't need a medical terminology book to look it up on a computer. If you want the language of medicine book, I have a language of medicine book that is an online book. I cannot load that full book inside of my classroom. It will not let me. It will let me load all of the questions, everything in there. But if you send me the flash drive, or if you go on my website, make that donation, I'll get the flash drive for you and mail it out to you with the book. Mail it. I mean, I got to go to the post office. I'm trying to figure out this postal thing that they got online. I'll figure that out, but don't worry about it. We'll figure out a way for you to get this book. I don't know how to do it. I might can load it on my computer and then transfer it over to you to the bigger, because I got a bigger ROM on this one. The Apple is so small. But we'll figure that out. But the language of medicine book is crucial. You guys know that. I got to figure out a way to get that to you, because I don't want you buying that. I have a one that you guys can use. Don't worry about that one. And a lot of what's in the classroom is a lot of what's in some of the workbooks and stuff like that. You don't need none of that. The other ICD-10, the CPT, the Hicks Picks is crucial. Don't worry about the other books. We're going to figure that out. But I'm 19 minutes in. That's what I wanted to pretty much talk about. And, you know, like I said, respect to those nurses that's coming in, but don't get shocked. You know what I'm saying? This is a city. You're going to see things that you've never seen before. You coming from the little, you know, I won't say you come from, you know, smaller towns and stuff like that. And you come into the big city, you're going to see a lot more than you ever seen in your life. Do not break. Do not break. Ask God to help you through it and get these patients and get them well. Because I cannot believe the patients that are being killed. I mean, sometimes I almost think that somebody set something up. I don't know. You know what I'm saying? The president, I can't with him. I can't. I just don't understand it. But anyway, that's it. Watch the Medicare, practice the Medicare. Get the insurance handbook, look up Medicare. Medicare and Medicaid is going to be whopping. Remember, that's my department, Medicare, Medicaid. Not that I can't do the rest of it, commercial and all, but Medicaid and Medicare, that's what's getting ready to jump off. So y'all pay attention. It's 20 minutes. I'm going to let y'all go. I'll probably do a video tomorrow. Bye.